And isolation is literally being isolated in a room. And it sounds drastic. It is drastic. It's supposed to be drastic. But that really limits the ability of that person to function. Plus, you're so sick that you can't even function, literally. But but your family needs you. I mean, that may be a single mom or a single parent, and there they are in their household by themselves with little kiddos. What are you supposed to? It's heartbreaking.
Senator, welcome back to Health Talks. We had a technical difficulty last time, and your willingness to come back on and do this again speaks volumes. Really appreciate you jumping on.
Well, thank you for the opportunity to come back, and excited, regardless of the reasons why we're here. That's what matters.
Right? Speaking about the reasons and what matters, let's talk about COVID. You recently went through and had an experience with it. Can you kind of give us an overview of that?
Sure. So as you know, time passes, it's been better for me to reflect on the process of what this disease is about and how people are coping with the unknown of COVID-19. And I think I would say that's the most important thing here, is to realize that nobody knows that much about COVID-19. And even healthcare providers are still learning new things. So I was one of the first, 180 cases in the state of Utah. And for me, it started in March, mid-March. I finished legislative session on March 13th, which was a Friday, and my symptoms started Monday, the next Monday, which is the 16th, March 16th. And during that time, testing availability was very limited. Clearly now everyone can go and get tested. I mean, there's free testing happening every day. And that's one of the things that we're here to make sure people know, that testing is available and that we will probably be testing multiple times through this whole process, because things can change. But during that time, the moment I connected with my healthcare provider, my doctor, family doctor, I wasn't meeting the criteria for testing. And one of the things I didn't have at the beginning of the symptoms was very high fevers. My temperatures were still within 100, but not hitting the 101 or 102. So I wasn't able to access testing immediately. And I, because of my asthma, that was obviously one of the things that put me at a high risk in a way. But, I didn't want to believe I was going to get this. I mean, and I think that's also important, right? There's a sense of uncertainty and stress related to the idea of having, being a COVID-19 positive. And so my doctor was, at that point, helped me. And I think that was very helpful for me, was getting steroids for my lungs and being able to help me with my breathing and lungs. And so I, started this on Tuesday night. And of course, Wednesday we had an earthquake. And that was, that combo was not fun. I'll say that, because then everything, everybody was so stressed about the earthquake, and it was a horrible, it was really scary. And the idea of, I think it was also a reminder of emergency preparedness and whether we're ready for that big one that we know will be happening. We don't know when, but is certainly an issue that also needs to be addressed. Are we prepared for emergencies? We were getting ready for this pandemic, right? We were getting our food, we were getting, people were already dismissed from work and starting the working from home. Kids were already staying at home. By that time, that was literally that weekend that was happening is when I got sick. But then my husband gets symptoms. So now it was spreading to the family. So by that time, it was not only me that was feeling very, it's painful. It's not, people say it's a cold, like a cold or a flu. I'm like, I don't know. It's very different. Your body's fighting this, and it's very painful physically, but it also, you don't have the runny nose, or, it's very dry. So, usually when you get a cold, it's like your eyes are watery, you have runny nose. That was not the case in here. This is very dry, and, it just is painful. And my husband starts the same symptoms three days later. By Thursday, he was very ill. And by Friday, both of us were now having these very high fevers. And I'm sorry, this is part of the new normal, kids around. I have
all good.
Like kiddos, So, we had this really, both of us sick, and we had, as you can hear, toddlers and my mom and two teenagers. So we had this full house, and now all of us were quarantining for the purpose of staying home and staying safe, stay home, following stay home orders. But now we had two people that were very sick, and then everybody else around us. Friday, we end up at the emergency room, and that's when we got tested, both of us, and our results came back positive. And of course, in the situation, giving your phone number, if I connected with you at one point during the last week. So that's where the contact tracing starts, right? And our local health departments have the role of connecting with people. You have to provide all this information. It's very uncomfortable. If you've never done contact tracing, you suddenly are at this point of, oh, please share your entire life for the last 3 days, who, phone numbers, where, places, where did you want to eat? And we didn't have a lot of activity because we were already kind of like gearing towards, like I said, the stay home order. But it was very different. I've never been through that contact tracing. It feels very invasive. And I've been telling people, please know why this is critical, because that's the only way you can stop the disease and the spread of the disease is by trying to follow the disease itself, and make sure that we put interventions and have people get tested or quarantined because they've been in contact with you. So that process out of itself was very unique and new for us. So we both got tested. We both came back positive, both my husband and I. And by the time you're supposed to isolate, but because my symptoms were, happened days before, 4 days before, we knew there was exposure already to my mom, which, it's a high risk population based on her age. And then our children, right? I mean, our teenagers and then the little ones. So that started our journey through this thing. And it was long. I mean, it's not, 2 weeks, I think, is just the what the CDC guidelines say in terms of you being contagious and, about spreading disease. But is physically, I think it's still, it took a long time to get where we are. And we definitely feel way better.
Sure.
Our little one, we had one of our little ones, our 5-year-old was the one that had to deal with very severe symptoms related to this disease, and more information is coming out about those symptoms to the point of that correlation with the Kawasaki disease. So she's been getting a lot of testing and more things done, but we're happy to see that she's doing way better. But for 6 weeks, she had a very severe symptoms related to that. So just to put it out there, children, adults, I mean, there is this, people think, oh, this isn't a disease that only affects, very, our elderly population, but the reality is anyone can get it. And then the symptoms vary. And I don't know that there's any scientific factors that we know. They're seeing obviously people with specific, diseases like diabetes or asthma, any respiratory diseases that get impacted disproportionately. But, we also see other communities that are being impacted disproportionately, like ethnic minority communities, and in our state, the Hispanic Latino community.
Yeah.
That's a long answer.
No, I love it.
my journey. So sorry. But yeah, it was a process, and we're still dealing with some of that ourselves, and as a family with some of our kiddos that are dealing with some of those, the aftermath of the symptoms as well.
So you are currently still dealing with that, you're saying? Yeah.
So my daughter, we just had her do her final visit to a cardiologist, a pediatric cardiologist, just to check. Because remember when she got it, which was at the same time that we were getting it, which is 2 months ago, there was hardly any information about the symptoms that we're talking about children now. I mean, these hives, and they thought it was an allergic reaction. Really, it was actually related to the COVID-19. Now we know, and it's very connected to this Kawasaki disease. So the doctors now believe that she was dealing with that at the same time. So we're still doing a lot of testing to make sure that she's fine. And we just had actually one 2 days ago that came out that she, her heart is okay, but we're still having to check on some of this stuff. And it's been 6 weeks and she lost a lot of weight. I mean, there's some of that stuff that we're still dealing as a family, and that's why I'm telling you, I don't know that it's such a high, not knowing is an issue, but I don't know that anyone or any family should like to go through that process. It's been painful as well.
Yeah, because that's a whole different kind of pain going through it as a parent. That's a whole different level. When you were saying that it was kind of scary, like reach that contact tracing and all of that, because you probably, and correct me if I'm wrong, but it's almost feeling like an interrogation, like you've done something personally wrong, right?
I mean, I'll tell you this, and it was, and maybe different people react different to issues, but I felt a lot of responsibility with the people I interacted without me knowing that I was sick, clearly. And I when the contact tracing happened, it was very eye opening because as you're, delineating, tell me what you did Friday, then Saturday, Sunday, right? Which is,
Yeah.
that was kind of like the timeline. Um, until Monday, where that was the last time I did anything outside of going to the hospital because I was really ill by that time. Then you realize how many people you get in contact with, even if you're not intentionally wanting to, right? So, well, I went to this meeting. How many people did you interact in the process from your car to the meeting? It could have been a receptionist, right? I mean,
Yeah.
everyone, and you're supposed to like explain all this. So yeah, it's invasive, but at the same time, there's a sense of, I mean, to me, I felt terrible. And, you know, because like I said, it was not that we did a lot of activities during that weekend, but there was a business meeting that both my husband and I were at the same meeting. And these are people I work with, business partners. I contacted them personally, and I know they were also contacted by the local health department. But I was like checking on them the entire time that I was sick. I'm like, how are you guys doing? Is everyone okay? And they never had symptoms. None of them ever tested positive, and they actually got tested. They quarantined themselves. They follow all those instructions, but you're absolutely right. To me, it was not only that how invasive it was and uncomfortable to have to, last time I checked, I mean, my dad was the last time that asked me, what have you been doing? Like, where were you? And here you are giving all this description. So I understand also for some people that may feel very uncomfortable and almost like an invasion of your privacy, but you have to in order to, so we can know where this disease may be spreading. And that's why the more social distancing you practice, the more, even if you see a lot of people now going back to semi-normal, it's really scary.
Sure.
You have to track if you become one of those positives. And I'm like, that sense of responsibility, that's a tough thing to carry. It's, you may have put someone in a higher risk, and because without even doing it intentionally, just by being in the same location and
Yeah.
being sick. And not, some people are asymptomatic, so they may not know they're sick, and they're spreading it literally, right?
Sure. So have you also done the test to see if you have now the antibodies like for it?
I haven't done the antibodies. We're ready. We are going to do it because we're ready to donate plasma as recovered patients. So you have to do certain testing before you do
Sure.
donating plasma. So that's our next step. We've been focusing first on us getting out, then our little one, which, that was, like I said, you actually described it very well. It was very traumatic and dramatic. Um, that was probably the worst part of this whole thing is our daughter, right? We felt very, well, and during the time that she was sick, we were in isolation, and we were on a telehealth doctor visit with her pediatrician, and at that point making decision of who's going to pick up our daughter and take her to the hospital because we couldn't do that.
Oh,
So that has been the hardest part of this whole thing. I mean, I think I can take the pain, the breathing, the physical
mm,
fight on my own, but then seeing my daughter sick and me being sick, not be able to take her to the hospital or make certain things that needed to happen was very, very difficult.
yeah. Wow. First and foremost, I just want to say I'm sorry you had to go through that. As a parent myself, it's like I can't process that. That's very difficult. So, way to be strong, mama.
Well, and you do get it, right? I mean, and I had some of my friends were asking, was like, and you were sick at the same time, which is, but yeah, I mean, it is, and we all deal with being ill in different ways, but yeah, seeing your little one, it's terrible. So that's what I tell people, be careful, because even if you say, well, I can handle it, or I'm strong enough, or, I have people have said that, well, I mean, I really recover fast. I'm like, yeah, but what if it's one of your loved ones and you can't even help them because this disease, there's a lot of isolation in this disease, right?
Yes.
so contagious. You can't even be with them at the hospital. That was my biggest fear. If you ask me, like personally, I mean, I was scared. I'm like, am I gonna be the one on a ventilator? Like, what if I have to be at a hospital by myself? And when we went to the hospital, which we were there for a short, less than a day, it was so scary. I mean, because you're isolated at that time. I mean, we were separated. There's hardly any interaction between providers and the patient because you're obviously contagious. And they're putting all the precautions and, guidelines in place. That's just not a pleasant scenario to be in. So I really hope people take, the measures they need to take to keep themselves safe and their loved ones.
I 100% agree with that. What do you believe, minus the medical treatment you received, was the one thing that helped you get through all this?
Well, I think there's two parts to that question. So one is like the mental part, like emotionally and mentally, just having, there was a lot of support. I mean, we felt a lot of support from the community. I mean, like my constituents were great. Our neighbors were great. Our church community, that was there. And we don't have family here. So in terms of family, that's who we are. And our family are far, and it was very frustrating that my brother wanted to come and help and he couldn't, so traveling, obviously, especially during that time when this kind of like, now you've seen more things happening, but during this time is when it was at its peak, right? So having the community and the support of loved ones and friends was critical and so helpful. People dropping food, because you take for granted this ability that you can go and buy something. You can't get out, right? You're supposed to isolate, literally. Like, you can't open the door and just leave. So that was hard. But so helping and just being in touch, and people sending texts and just phone calls, and just what can we do? That was great. I think what helped us a lot, because there's no cure, right? So you don't have a medication to take. Or you're like, hey, you're on your own. Good luck with ibuprofen, and call us if things worse with the breathing, right? That's kind of like the instructions you get. But for us, we heard a lot about just taking hot beverages, so like teas, hot water, so not cold water. And I believe that really did change the dynamic, because there is something about this specific disease is, like I said, it's very dry, and it's a big virus. Like, yes, in terms, we see the pictures, but in terms of how it gets stuck in your lungs, and so you need to have more fluids. So the more fluids you take, I think that certainly made a big difference. So I've never taken so much tea in my life, warm, hot tea, because I don't drink any other, drinks that are hot. I mean, so a lot of chamomile and tea, mint, mint teas. We went through boxes of those things, but it was what we were drinking. I think that definitely helped us a lot. Just keep yourself hydrated, but with warm fluids and warm drinks, it, I think, made a big difference for us.
Absolutely. So you said the community stepped up, like would bring things over and stuff. Did you still feel like there was this sense of they wanted to be around, but the distancing thing? I mean, it's a very scary disease, right? I think there's a lot of fear base behind it. Did you notice that a lot while you were going through it, your interactions with others?
I can tell you I didn't have interactions with anybody. So, I mean, like, no, definitely. Like, I don't think anyone wanted to interact with us. And I didn't want to, because I was so scared of getting somebody else sick. I mean, and maybe I sense that that was pretty unique to me, because I've never heard somebody else say it. Like, I keep on repeating it, how scared I am of getting people sick. During that process, I wouldn't even nothing. I just didn't want anyone to go through what I was going through. And to me, that was that sense of responsibility is too big of a weight to carry. So there was, I think, so the funny part is the only people we were kind of like reaching to talk to were our doctors, and especially our pediatrician, because of our kiddos. And they were like, nope, we all telehealth. Got it. I'm like, I'm out of the quarantine. I'm otherwise, according to the CDC guidelines, they were not taking the risk.
Sure.
So, that was the only place where I felt that, where people were being cautious, which it makes sense. But it is a not feeling, because then my daughter, she's like, great, now we're the kids in the school that got it, like the family that got it. I'm like, yeah, okay, thanks. So yeah, that's, other than that, but we really have been, I mean, literally our kiddos have been only out once in the last almost, 2.5 months, just because we decided to stay home. I mean, we made that a decision just based on our own experience.
Sure. So, have now that things are opening up, have you thought about like going out and doing things, or are you just like,
Yeah, I've done, so for example, last Friday I was at the state command center,
hmm,
in my capacity as a senator. I'm from work. I mean, like my full-time job, we are doing everything telecommuting, so that hasn't been an issue. It's hard to serve clients, but we are using Zoom and trying to utilize as much technology. Yeah, so I've been out, for grocery shopping a couple of times, but I'm still, very hesitant. I mean, we're getting there, but I'm not, especially with the kids. I'm just not comfortable. I really want to keep my kids safe, and I know that kids get it. I mean, clearly my household is a perfect scenario where, yeah, some of them did and the other ones didn't, but we had positives in our household of children. So, this idea that kids are safe and they're not going to get it, I don't know that it's not accurate. Cases are out there in their children that are positives.
sure. So, as your role as a senator, and now with going through this experience, has that impacted maybe the way you view certain things, or any policies that you're now wanting to work on because of this situation?
Absolutely. One, we're doing a lot more. I mean, so I started this initiative on addressing the vulnerable populations. So those are, your ethnic minority communities, west side of I-15, which is my district, where we're seeing this huge disproportionate impact of COVID-19 positives. We started an initiative with other legislators and working with the executive branch in collaboration of the Department of Health, Office of Health Disparities, Salt Lake County, Salt Lake City. We're doing really targeted testing and services related to housing and food security, so these families can actually take care of themselves, especially those COVID-19 positives, because it's hard to ask someone, hey, can you isolate, but you only have one bedroom and one bathroom apartment, and you have 5 people living in that. I mean, that's the life of many people, and especially in Salt Lake City and Salt Lake County, where housing is so not affordable. You have multiple families living in one house. And this idea of isolation when someone gets sick is very difficult to comply. So we are finding resources so families can do that and individuals can take care of themselves. So food and housing security are our priority. Targeted testing where you have the hotspots, so we're following, so interventions can happen in areas where you're seeing those high COVID-19 positives. A lot of it is also based on occupation, right? So we're also connecting now, and this is our next step on our project, is worksite testing, and how do we then connect services to them. So I've been putting a lot of effort. It's been keeping me very busy, and it's been because I know how difficult it is, and it really is painful. I mean, I can't imagine families that are on food stamps and they need to physically go and with their card paid for food. If they're sick, they can. If they're positive, they can be, and they should not be at the store. And if they have to go and press those buttons of the PIN number, because if not, if somebody else does it, that's actually a violation of federal law, potentially could get them in trouble. Those families, what are they supposed to do if that's all they can get their food from? So, for some of us, we may take for granted the ability to go to Amazon or Spades or whatever, buy online and get things delivered to us. Not everyone has that ability. So we're looking into that, and it's been great to work and see the commitment of people from the state and the city and the county, organizations that want to help. So I've been working on that. We've had 4 special sessions since this whole process. We're heading towards cutting the budget by 10%, which is going to be devastating. And we are now focusing a lot of that. So yeah, it's been a busy, while recovering from this, I've been very focused on this work. I mean, we've been very busy in the state, and I want people to know that their elected officials are working hard. I have to say, we were not prepared for this, and it's been hard, and a lot of families, we know the economy is hurting. We're trying to bring us back to where we can help each other, but our budget is going to hurt, and we have to cut it by 10% just so we can start our fiscal year in 20 on July 1st, which is the fiscal year 2020 to 2021. So more to do and more work will happen. But yeah, we're committed, and absolutely, I have not been shy of speaking up about just logistical stuff that if you've not been through this, you may miss it. Because again, we don't think too much about what it means to be in isolation, which is different from being in quarantine, which is different from social distancing. And I've talked about using these terms interchangeably, but they're not the same. And
Sure.
isolation is literally being isolated in a room. And it sounds drastic. It is drastic. It's supposed to be drastic. But that really limits the ability of that person to function. Plus, you're so sick that you can't even function, literally.
Yeah.
But your family needs you. I mean, that may be a single mom or a single parent, and there they are in their household by themselves with little kiddos. What are you supposed to? It's heartbreaking. So my goal has been to find gaps or places where we can help in the system. So the systemic part of government that we can then help, and at the same time, not only help individuals in need, but that's helping our entire state.
Absolutely. Senator, I've taken up enough time, but I just wanted to give you an opportunity. Is there any other additional messages that you would just like to share with people in regards to COVID-19?
Well, say that we, as a state, I think we've been able to intervene in certain areas where we are in a better position than many other states in the country, and I I think we should be very grateful. And I'm grateful, and I feel blessed that we are in that position as a state. But we still have a lot of families, a lot of people that are disproportionately being impacted, and that the recommendations that we're hearing from our state leaders are recommendations based on CDC guidelines and on science that are telling us to be careful for a reason. It is hard, and in the state of Utah has taking an approach not to enforce a lot of these recommendations, and there's different perspectives to that. But at the end of the day, it is what we have right now, and I really hope that people understand that when we're moving from one color, from orange to yellow and potentially to green, which is a conversation that's happening now, which allows us to be more open and we do want businesses to open and continue to succeed, that those measures of caution that we need to take are for a reason there, and that the 6 feet of distance really makes a difference. That wearing a mask truly makes a difference. It's not to bother people. We know it's not comfortable, but what you're preventing is really such a huge thing that being uncomfortable for 20 minutes while shopping for food is not gonna, or while doing your nails or doing your hair, is doesn't compare to potentially losing losing life. And we know that this disease may be a life or death situation for some, not for everyone. And I feel that I'm very lucky that we were able to overcome this as a family. We don't know what other things we may be dealing with, because that's part of this COVID-19. We don't know anything. But I certainly would have preferred not to have to go through this personally. So I really ask people, well, I have people say, well, I've never even met someone until they meet me or something that was positive. And I said, well, hopefully, more people don't get to ever meet someone that was positive, right? I hope we can stop this fast. And, we're certainly looking into that. They were talking between a year where we can get our vaccine. So then it becomes just another thing that we can just control with immunizations, which is another campaign for the Department of Health to endeavor on. Just you realize how important immunizations are. Until we get there, this is certainly the wild, wild west. And I hope people take it seriously, because if they love their family, they love themselves, they don't want to be put in that position. So the more we can do to be safe, the better. And I don't think it's a big ask to stay home and to stay safe.
Absolutely, Senator. Well, I'm sorry that you and your family have experienced this, but I'm very grateful that you were willing to jump on and to share your experience. And I'm glad to hear that your family's recovering and doing well. And
Thank you.
yeah, thank you so much again for your time today and for jumping on Health Talks.
Great. Well, thank you guys.